Hi, today's episode of Vision and Voice, we're interviewing Nida Rizvi with Simpson Chiropractic. We're really glad to have Nida here today. Nida is a nurse practitioner, and she's been at Simpson Chiropractic for about the last 4+ years. And she's going to talk about some of their weight loss programs they're doing, vitamin shots, and really all types of things. They're doing so many things to do with health and wellness. And Nida, can you tell us a little bit about yourself?
Yeah, absolutely. So I've been a nurse practitioner for a little over 4 years now. Got into it, into this field, I should say, by accident almost. I kind of had moved from Broward to Stewart, was looking for obviously a job, from relocating, and I saw that Simpson was looking for an aesthetic nurse practitioner, and I figured, we'll give it a shot, and I ended up really enjoying it, like a lot. So got really into the peptides, the weight loss programs, like figuring out how to put it all together, and then also like the cherry on top, Botox and fillers, like how to make people look better, feel better, and just combine it all.
I didn't know you did that.
Oh my gosh, yeah.
So when you say peptides, that's Ozempic?
Ozempic, Mounjaro.
Okay.
Some people know it by the brand name, or
Got it.
semaglutide, tirzepatide. Yeah.
What's the better one you recommend?
Everyone will say tirzepatide, and just based off of my experience, tirzepatide is so much better. It's kind of like semaglutide, but with a boost. So whenever you get clients that, I mean, they're older, everything's harder, when you're older, right? On the semaglutide, they won't lose as much weight as they could if they were on the tirzepatide, which is Mounjaro.
Okay.
It works so much better. I always say the semaglutide is like the brake, right? Like if we compared it to a car, it's the brake, it's lowering your blood sugar, it's reducing inflammation, and it's helping you lose weight. But then tirzepatide is like that boost with it. So it's working in two different ways, like a turbo boost. So it's basically taking those great not side effects, but great things that the semaglutide does and just pumping it even more. So
Now, I think I did what's the better
probably
one?
the tirzepatide,
Yes.
which is
No,
Mounjaro. Yeah.
I lost, to be honest with everybody, I lost probably at least 10 pounds on it, and quickly.
Yeah.
And I felt very healthfully, and I didn't work out initially. Now I've been going to the gym. We've been doing the 5 a.m. club type stuff, and I've weaned off it. I haven't taken it for probably a month or so, but it really accelerated me to get in the gym. I lost really almost 40 pounds.
No, that's amazing, and that's how it should be done, honestly.
Someone explained to me when you have that much extra weight, 40 pounds, if you take a 45-pound weight and hold it around and carry it around all day. That shocked me because it wears out your joints, you're exhausted. And so I'm not going to say it right, the tirzepatide,
Yeah.
I don't think I could have done it because once I started to lose the weight, I started to feel good. I'm like, this is exciting. I'm losing inches on my waist. I'm finding clothes I haven't worn in a long time. I have clothes I haven't worn in 10 years.
Yeah.
So it's a big deal. And, I was talking to you before we went live. It was a psychological thing for me. Like, I felt good. It made me want to get to the gym.
Oh, yeah.
Kind of weird, right?
Yes.
Do your other patients have that same thing?
Yes. At the beginning when they first started, one of the side effects is fatigue. So you kind of get that little struggle in the first 2 weeks. They'll probably lose just a few pounds. But then after that little, letdown, you suddenly get this drive to eat better, work out, especially when you start telling them and weighing them, especially on that tool. I don't know if you've ever seen it, the InBody. It's our little tool. It's a scale, right?
Is that where you hold?
Yes, yeah. So you step on it. It tells us your weight, but more importantly than the weight, it's your muscle mass, it's your body fat. So when someone comes in after being on a low dose for a month and you tell them, listen, you've lost 5 pounds, which is great, but you've lost so much muscle, and this is what's going to happen if you lose too much muscle, it kind of wakes them up in that sense.
So I've heard that could be, if you don't, you can take it to start to lose weight, but then you have to really start eating right.
Oh my gosh, yeah, it's
and
all
then get
in that.
To the gym?
Yes.
Okay.
So it's going to be your weight resistance activities. You have to lift, and then you need the protein to feed those muscles, because if you do absolutely nothing and you're relying on just this medication, you'll lose the weight, but you'll lose the good weight, which is the muscle, and just keep the body fat on you.
So I didn't listen initially, to be pretty honest, and you kind of know that with chasing me for my blood work and all that. But I did eventually, thank God I did, because it changed my life.
Oh, yeah.
Losing the weight, I really didn't have my words earlier, but losing the weight motivated me. I'm like, wow, I'm looking a little thinner. I'm like, okay, and you kept hearing Dr. Charlie would say, Glenn, you got to You got to work out. You're going to lose.
yeah.
You're going to lose muscle. You're going to lose muscle, and I did.
Yeah.
And so, and I was like, oh, that's. I feel better, but I don't want to. I want to have the muscle.
Yeah.
Anyway, so I started eating right, a lot more protein. How much more?
Yes.
How much more protein do you need when you do
It's
that?
hard to say because it's kind of dependent on the person.
Okay.
And at the end of the day, I'm not really a nutritionalist either. So I
understand.
kind of just go off of what the in-body tells me. So especially when they first start and I see, like, let's say this person is, I don't know, 150 pounds. They're technically, their BMI is showing that they're overweight and their muscle mass is maybe like 32.
Got it.
I just want to make sure that they don't go below a certain number. Because if that number and that's on that scale just keeps going lower and lower every month, that's a sign that they're not doing that lifestyle change.
Yeah.
So it's more of that. I will really depend on that to tell me.
I didn't do the lifestyle change, and you can't really drink on that either.
No.
So I made
Yeah.
the mistake of doing that.
And it reduces the craving for it, which, I mean...
It actually did.
It's good and bad. I guess it really depends how you look at it.
I mean, now I'm, not drinking at all, and I'm working out, and I've weaned off of the, how do you say it again?
Tirzepatide.
Tirzepatide.
Yeah.
That's the generic form of
Mounjaro.
Mounjaro,
Yeah.
okay. So Mounjaro is a lot easier to say.
Oh, yeah.
But it losing the first 10 pounds, which really helped me do that, then got me to start eating better, then got me into the gym. Probably did a little backwards, but then I just loved the way it made me feel. I feel great. I've lost weight. So I think I was on it, and not as consistently as I should have been, as you know, but probably a while, 6 months, I would think. So it kind of took me, by the time I started getting in the gym in November or December, and then I lost that extra 10 pounds. So if I go back a year ago, maybe I was on and off for a year now I think about it.
Yeah.
But at one time, my highest weight was 239. So let's just say 240, and I'm down to maybe 205 now.
No, that's amazing.
That's a lot.
And I mean, it's also, again, how you're doing it. I mean, when someone comes in, we do that low and slow increase every 4 weeks. Once you get pretty close to that goal weight, that healthy weight, let's just put it that way, that's that indicator to start. You could wean off of it, or you could just stay on a low dose just for that little help.
What's a low dose? Like what?
So for example, if I have someone at 50 units, right, and they've almost lost their goal weight, at that time, I'll just start going backwards a little bit, low and steady amounts.
So by the way, we have a special guest. We have 2 special guest stars. So we have 2 special guests. We have our Clipper and Addie, our mascots, are just here. So Nida, what is your favorite dog?
Oh my God, I love golden doodles.
Golden doodles.
Yes.
Okay, so Nida, we brought these here for you.
Hi.
Oh my God, hi.
Oh my God.
Come here, guys. Come here.
Oh my goodness. Oh, I got them both. Hi.
Come back.
Hi.
So guys,
Oh,
this
she's
is
a
a
fighter.
little impromptu. Come here.
I love
Clipper.
it.
Oh, you want to-
Hi.
That's good.
Oh my goodness.
All right.
They're little babies.
I know they are,
Oh
right?
my
I'm gonna
goodness.
take
They're
this
so
off.
excited.
So we're going to try to film. So, puppy's lower blood pressure, by the way.
Oh my God, I
Look
feel
at her
that.
face.
She's
So
so
guys, this
cute.
is Clipper, and Addie's talking. Joe, what do you think of Addie? She's cute, right? She wants to say hi to you. Oh, that's great.
Oh, she's
We'll have to
gone.
get some behind the scenes. All right, there goes Clipper.
It's a typical
well, that
toddler
was-
right
that was
there.
fast. So I was up to, 239,
Yeah.
really 240. And I lost definitely 10, 15 pounds. It took me probably now that I'm looking back, probably 6 to 12 months. I would not consistently be on it. But really what made the difference is diet and exercise.
Oh, yeah.
And that's what you recommend
Yes.
initially.
Yeah. And that's the biggest thing I tell people. Like, people come in wanting to lose weight.
Yes.
But the thing is that this should just be a push to make that change, go to the gym, eat healthy, and then we can just have a little low dose of this. Like, that is always the goal. You don't want to depend on this.
And the
you
dogs
know?
aren't distracting at all.
No,
right?
no, I know. I'm
not at
like,
all.
you're so cute.
Hi.
Do you want my water?
Oh, there you go. So there you go.
You
So that is
thirsty?
Addie drinking your water. Is that on film?
Oh
Okay,
my
well, there you
God,
go, guys.
I love that.
So these are our
The
mascots.
eye contact, too. She's like, yeah, I'm
She's-
drinking your
oh,
water.
yeah.
That's
I
right.
just dialed right in.
She's like locking eyes with me while doing that.
So anyway, all right. Well, this is an experiment. Thank you, Netta. You're a trooper. So a couple personal questions. and We'll get back to this.
Okay.
So you started working for Dr. Simpson about how many years ago?
It's been about 3 years, actually. Yeah.
So prior to you,
Yeah.
I got a vitamin shot there, and So I get a vitamin shot. This is maybe COVID time,
Yeah.
right, too? So I get a vitamin shot in my arm, which you would never do.
Oh my gosh, no. Butt
And
cheek all the way.
I couldn't drive my car, so I'm calling Dr. Simpson.
Yeah.
I know Charlie pretty well.
Yeah.
We're good. Anyway, so I can't drive my car. He is laughing. He's literally dying laughing. I'm like, Charlie, I'm having. He goes, Glenn, it was in the. What was it in the muscle?
In the deltoid, yeah.
Deltoid, yeah.
It's
So
just
you
it's
don't do that.
uncomfortable. Yeah.
So Nida has. I mean, I go to Simpson Chiropractic, obviously, and she's given me vitamin shots. So Joe, you get vitamin shots too, right?
Yes.
Do you highly recommend them?
Yes, I do.
Thank you.
Yes.
Thank you, Joe. That's Joe Durek, by the way, everyone. He was on our podcast number 5, I think. Thank you, Joe. So, but you recommend vitamin shots. They do work.
They work.
Yeah, vitamin B, you get B12?
B12.
B12. So you do B12
Yes.
shots?
B12 and amongst other
Yes.
things. Yeah.
So now when I go back, and I don't go back as often as I should, she'll give me a B12 shot, but not in the arm, in the
Yep, on the glute. Yep.
on the glute, yeah.
Always.
And for me, and to be honest, I can't say. When I used to get a lot of shots as a child for allergies, 1 a week, so 52 years. So I don't like shots. So Nida kindly puts that spray. What's it called?
Ethyl chloride spray.
Non-man card spray on me. But you're good like that, and,
Yeah.
and your whole office is like that.
Yeah.
You're kind, and if you see someone getting nervous, I get.
Oh, yeah.
I know you see my anxiety, right? Yeah,
Definitely.
You're very
I
kind.
always get actually nervous with you because you always kind of
Did you really
give
need to
that
put that
like
on camera? I know you do. I get a little anxiety.
I'm always a little like iffy if whether or not you'll pass out while I start
Really?
that IV. Yeah, you
Wow.
kind of get a look.
Oh, that's not good.
A passing out
Oh, there
look.
you go. That's pretty funny. Excuse me. Well, I didn't know that.
Yeah.
So, but you're kind, and I appreciate it. Your whole office is like that.
Yeah.
So if you've never been to Simpson Chiropractic, and now you're not just chiropractic, you're a whole spa.
Oh
right?
yeah, it's a whole like health and wellness retreat.
It's got
awesome.
a
Yeah.
great vibe. It was built in 1926.
Yeah, it's been around forever. I didn't know it had that much history.
It does.
It's crazy.
It's on
It
Fraser
used to be a
Creek.
house at one
Yes.
point. I didn't even know that.
I think, and I hate to say this, they used to, like, that was in the 1920s.
Yeah.
Like, a lot of those older homes were like bootleggers. I don't know if you know that. And
No,
so
I didn't
think
know
that
that.
might have a little history.
Yeah.
Allegedly.
Yeah.
Allegedly. But no, it's a beautiful environment. And, for someone like me, like Charlie, get adjustment, no problem. But I just don't like needles. And so you sense that. And they're really good about it. So I highly recommend going there. And you're fantastic.
Thank
and I
you.
appreciate it. I mean, sincerely. You didn't really
Yeah,
have to tell
yeah.
my,
No,
but I
absolutely.
mean,
Thank you.
but no, I appreciate it. And most places won't do that. You guys actually care.
Yeah, I think being super patient and really calm is key because once you see someone walk in high anxiety
Yeah.
and freaking out and you're kind of anxious to start it because they're freaking out now, you're
I do
freaking
get
out.
anxious when I
You
think
just
about it,
don't
yeah.
want to you just want to make it seem very
Yeah.
whatever, chill, it's fine. It's
Yeah,
not
that's
a big
what
deal.
you always change the
Yeah.
subject, and I think
Yeah.
about it. Anyway,
yeah.
they're great like that. So my other question is, so you've been there about 4 years. Where are you originally from?
Virginia.
Virginia?
Yeah.
And what brought you to Stuart, Florida?
So it's interesting. So lived in Virginia, was in a long distance relationship with my husband. He's born and raised from Florida.
He's a great guy.
Thank you. And it was just, I don't know, it was a no-brainer. It was live in Virginia, which I love Virginia, but it's cold and depressing. Or go to sunny
That's
Sunshine
true.
State.
I love in the summer, Virginia's
Yeah.
beautiful. What's the name of the area? Because you said it earlier.
So I lived in Woodbridge, and then I worked in Fairfax, in Fairfax
it's
Hospital.
the DMV.
DMV, yeah.
DMV. So
DMV.
you said that, and
Yeah.
then Lewis knows what that means.
Oh,
His
yeah.
wife is from that area. So DMV means
DC, Maryland, Virginia.
Okay, got it.
Yeah, that's just the easy way to break it down.
the most affluent area in the world,
Yes,
honestly.
yeah.
I think the most affluent county.
Yeah.
Yeah, it's from
Oh,
there.
yeah.
So, and then you live with your parents, just kind of a brief history. Your dad was an engineer. Mom
Mm-hmm. Yeah.
was a stay-at-home mom. How
Yes.
many kids in the family?
5 total,
kids.
all of us 5.
And you're the favorite.
Yeah, and they know it. That's why I will totally say it out in the open. It's a joke that we have. I mean, I'm the golden child. I'm
That's
the
hilarious.
good child. Pictures everywhere. You're lucky if you see, 1 or 2 pictures of them somewhere. It was just a table, of me, like a shelf of just pictures of when I
Doesn't surprise
graduated.
me.
And
No, I asked her these questions earlier,
Yeah.
everyone. So getting back to just more business talk, thank you for sharing
Yeah.
that, by the way. We're glad you're in Stewart's.
Yeah.
You're part of the Stewart heritage. You have a historic home, or practice. It was a home. Is it on the Registry of Historic Places in Martin County? It could be.
I don't know, but I wouldn't be surprised.
I'll talk to Charlie. You can do that because that is
I didn't know
1926 for Florida. That's an older
And I mean,
home.
I'll hear something new, here and there when patients come in, and they'll say, like, "Did you know this was a ballet studio at one point?"
It what?
Apparently, someone said this. I don't know if this is
I think
true.
it was.
Yeah.
I think that's before my time, though.
Yeah, it's
I
insane.
want to say though, I'll double check on that bootlegger thing because there were a couple homes. It's on Fraser Creek. Well, that was cleared out. So they would sneak it down. My understanding, that's allegedly, I don't know.
Mm-hmm.
Some of the old Stewart families, they all tell stories. I don't know if it's true or not. Probably is. Okay, so now the other things you do besides Monjuro and the different stuff, Trisepatide?
Yes.
And what's the other one besides Trisepatide?
You're talking about semaglutide, Ozempic?
Ozempic,
Yeah.
Okay. It worked for me just to, if you're thinking about it and you've been struggling with weight loss, I'm a little bit older. It lost that first 10, 15 pounds, and then it motivated me to drop the other 20 plus pounds.
Yeah, and amongst other things, I mean, it's good for inflammation. It's good to cut out cravings. So if you have a bad craving, whether it's chocolate, alcohol, whatever, it does work. There's a study that they did recently, and they're going to use it on alcoholics to help that issue.
To be honest, I'm a non-drinker. I do not drink, and best decision I ever made. One of the things, and you brought it up before we went on camera, that started me drinking less and less.
Oh yeah.
It really did, and it was. And I think you did tell me that. I didn't really put it together till we were here today.
Yeah, you don't realize it till you're on it, and you literally can look at this amazing-looking drink and feel nauseous just by looking at it sometimes.
I did get a little nauseous when I first took it. That's normal, right?
Yes.
Not drinking, but
it's
from
one of the
shot.
side effects. It's like the most common side effect.
It went away. I don't get it at all. I'm not on it now, but it went away the last 3 months. I didn't really
I feel like when you first start on it, you're typically, and this is all very mild. I've never had anyone have a severe issue on this, thankfully, but it's always a little bit of nausea, a little bit of constipation, anything in the GI system, basically, mouth to the end, and it subsides literally 3-4 weeks later, and you're totally
fine. Mine did too, so
it
was totally good.
Yeah.
So then you talked about you also do Botox and some other things.
Botox, fillers. Okay. Oh yeah.
I don't know what that is. As a guy, I mean, although I want to kind of get something here. I was talking to Charlie. Do guys get it?
Guys, you'd be surprised.
What?
The most macho-looking men do so much Botox.
Botox?
Yes, and you can make it look very natural. It gets that negative, misconception to where
we're going to delete this. So what do you? So I'm on. What do you put it here?
Botox, yeah. So it's FDA approved. Forehead. It's going to help soften those lines.
Yep.
Your 11s, which is like this muscle.
Is that there?
Yep. This little 11 that we get.
What do you think, Yvonne? Should I get? I think, or maybe. You know what? I don't want to.
Come on over.
I don't want to spill the beans on some of my friends, but I think a couple I know. You probably know who they are.
Oh yeah, and one of them is let's just put it this way: he's my poster child. Everyone knows.
Really?
Yeah.
Someone I know?
Someone that we both know.
Oh, okay. I think I know who it is.
Yeah, I joke with him all the time. I'm like, you're my poster child. Like you.
So if you were gonna, I'm actually curious, honestly, guys. If I was looking at Joe, don't repeat this. But if I was gonna do it, what would you do? What would you do for me? If you
wanted the most natural, refreshed look, definitely start with Botox. I wouldn't want to overwhelm you and do Botox filler right here to soften these lines, because right now you have wrinkles that just from raising your eyebrows a lot, it forms from a fine line to a wrinkle. So you're in that in between phase where you want to do it now before it really gets deep.
Okay. It can stop it from getting worse.
Yeah, because essentially what it's doing, it's paralyzing that muscle for 3 months, 3 to 4 months. So, and it sounds scary, right, when you put it like that. But it's essentially to where if I, let's say I injected you and I saw you 2 weeks later and I told you raise your eyebrows, you would not be able to really raise the eyebrows and see all those lines. However, you do have some wrinkles, so you'll see those lines still because they're wrinkles, but over time of not being able to really raise those eyebrows and see all those lines that you're getting, it'll soften out. So I'm pretty interested, actually. Yeah.
I would
oh my God, you would love it.
So, and I'm going to say,
and you can customize it.
Really?
Oh my gosh, yeah. People think it's frozen.
I notice I have these. I don't know, just bags under my eyes. I mean, is this Dr. Adler?
I would 100% Dr. Adler. Yep. That is eye
Dr.
surgery.
Adler, I'm coming. I figured it would be.
Yeah.
So I joke. I don't know if I joked this. I have a friend that he calls him like, "Hey, you got George Clooney ball sacks under your eyes." I'm like, "Thanks a lot."
And honestly, you would love it, because filler for the under eyes is going to be more for that hollowness versus the eye bags.
So this would be a little bit of like very outpatient plastic surgery.
Oh yeah.
Cut this out.
Absolutely.
So for the podcast, everyone, I guess. So I do this and then Botox.
Yep. You can do your forehead. We could do your
What's the other?
11s, crow's
Is
feet.
it what is the other thing?
Dysport?
Dysport.
Yeah. So yeah, it's just another form
do
of
Dysport?
Botox. Yeah. So they're pretty similar. It's just different companies that make
That
them.
lasts longer?
They're both relatively the same amount. I mean, 3 to 4 months is more or less where you'll be at in terms of how long it'll last. One takes 2 weeks to take effect, which is going to be your Botox. Dysport kicks in about 5 days. So it really just depends. Are you anxious to see the results, or can you wait a little bit? And I also feel like Dysport can be a little softer versus Botox can give you more of that like tight look. So it depends.
Yeah.
It really
what
depends.
would you recommend for if you were going to do
I would say Botox.
Botox?
Yeah,
Would be,
I would
and
say
that
Botox.
takes
About 2 weeks to fully
Okay.
settle. Yeah.
And Dysport's a little quicker.
Yeah, about 5 days. Yeah.
But you would do Botox just because it's more natural or tighter? Or,
You know, I love both. It really just depends on the person. I feel like, and this is just me, this is my personal opinion, I feel like Botox, for some reason, lasts a lot longer than
Okay.
Dysport. But again, that is very subjective. Other people will say the exact opposite, and they'll argue that.
so I'll make, because I know you're thinking
Yeah.
of doing a show. We'll
Yeah.
do a before and after.
Okay.
How about that?
Yeah, no,
We'll do a
I'm
before and
totally
after
down for
with
that.
me. Charlie's going to laugh at this.
Yeah. He'll be
I'm actually
excited.
really interested.
He's going to be so excited that you're doing
And
it.
if I go to Adler, I'm not going to know. We could probably do that too. I'd love to interview Dr. Adler. So
Oh,
you
yeah.
know him.
I mean, I know of him. I don't
Yeah.
know him personally, but
He's
I've
a-
always heard him.
he's fantastic. Yeah, he's good.
And
So- and he knows
I've seen
Charlie
his,
very
like,
well.
you know, I've injectables, you know, who have seen him for other things, and they look amazing.
Yeah.
So he's obviously really good at what he does.
Yes, very
So.
much so. I know him and Charlie are friends and all that. So, okay, so Dysport, Botox. What? Now you have a spa too, right?
Yeah.
What's the name of the spa?
Wellness Collective.
Wellness Collective.
Yeah.
Is that the name of your whole company now, or is it still Simpson
So
Chiropractic?
it's half and half. So Simpson Chiropractic for that chiropractic aspect, right? And then Wellness Collective is going to be more of the injectables, the weight loss, but also the amenities of the sauna, the cold plunge, red light therapy, and then we even have the body sculpting machines that help with tightening and toning.
Really?
So yeah, there's a lot going on.
When I go in there, I was telling Charlie earlier, you always have new equipment. You're always
gosh, yeah.
always new equipment. Some of it looks kind of medieval to me. Like, you know what I mean? They're stretching you out. That's the
Oh, yeah.
chiropractic stuff. But tell me about the red light. 'Cause
Red light
that
therapy is
intrigues me.
awesome. Yeah. So red light therapy, and there is actually a lot of great research on it, which is so interesting how they even found this out. But red light therapy is great for essentially everything, for inflammation, for anti-aging benefits, for just overall, you know, health and wellness. People will do it for anything, honestly, and it does really help.
How long do you have to have the red lights on you?
It's about 20 to 30 minutes.
minutes?
Yeah,
Is it
and you can do
standing
it once
up
a
or laying
week.
down?
No, you're laying down. You're literally almost laying on the tanning bed. Like that's what it looks and feels like. That you're just in this tanning bed for 20 minutes.
Okay, so I've done it standing up.
Really?
Yeah, where you stand up and
Yeah.
that's red light, right? It's
I mean, it could be. Maybe it's a different
a
machine.
little different.
Yeah.
But anyhow, but not at your office. That was
No,
that was
no.
a different place. But okay, so the red light you'd recommend, and that's like a Dana White type stuff.
Yeah.
Right? So I was telling Charlie that too. I know Dana White has that whole thing. So red light, cold plunge, right? How cold is your cold plunge?
Okay, so I'm gonna be honest. I haven't even done it yet. So I'm like afraid to even go back there.
Is that upstairs or downstairs?
No, it's downstairs all the way in the back. It's
Okay.
right next to red light. It's very
Okay.
cold. I know it's extremely cold. You're supposed to do it if you can even get that far.
Has Charlie done?
I think he has. I'm pretty sure
Well, I know
he
he
can do
does,
it.
I
Yeah.
see, yeah.
And I think he's done it for longer than average, which is like 3 to 4 minutes. You're supposed to stay in there. I want to say it's 6 minutes, at least 6 minutes.
I mean, I'll try that.
It's not easy.
So you have, of course, we have the Botox,
Yeah.
the Dysport, the Wellness Collective has the red light, the cold plunge, the salt room. I've done your
IVs,
IV,
yeah.
NADIV, which
Yep.
I love. I think that's
Yep.
great. NADIV.
And the beauty of all of this is that it comes together so nicely depending on what the issue is. You know, if you're coming in for, someone who is just interested in anti-aging, knows nothing about Botox filler or anything. I mean, that low and slow approach, you do your once a week IV or once a week vitamin shot just to feel better. Some of them are overweight. Low dose of semaglutide, tirzepatide. Some of the weight loss patients will end up doing a little bit of Botox and filler because, you start losing weight and you start seeing it in your face. We have to start, plumping it up, but also giving that refreshed glow.
So you don't get the Ozempic look.
Yeah.
Now, you were saying earlier, why do you get the Ozempic look?
It's a lot of different things. One of them is people being on really high doses too soon, too quick. I mean, they're losing 10 pounds a month and they're happy about it, but it's not a good thing because, as I've said before, you're losing muscle and you don't want rapid weight loss. You want to lose like 4 to 6 pounds every month.
Okay, so that's pretty healthy.
To me, that's pretty healthy, depending on what you're doing along with it.
Okay.
If you're really working out, you're really eating healthy, 4 to 6 is a pretty good goal.
Okay.
As long as the muscle mass maintains or grows a little bit and your body fat goes down.
I clearly lost muscle mass and it was noticeable. And then I started to, that's what got me to the gym.
Yeah.
So I was like, I felt great. I'm like, but you definitely felt it. So that's like, as long as it came back quickly.
Oh, yeah.
I mean, I don't know if it came back quickly, but it did. Once you start working out, it works. So.
And I mean, at the end of the day, also, it's outside of, being on a high dose too soon, too quick, and losing so much at once. There's the other end of it where, I mean, you could have a 35-year-old patient who's 250 pounds who, and this is true, I mean, I've had this patient on tirzepatide for a year.
Yes.
Pretty moderate doses. She's lost over 100 pounds. She looks incredible, but she could now use a little bit of support right here. Just because you lose weight, you're going to lose it in your face.
I think that happens.
Yeah.
I think every time, even not on Ozempic or tirzepatide. But you did my sister Mary, didn't you?
Yeah.
I forgot about that.
Yes.
So my sister Mary, and she lost, I want to say, not as much as she should have, because she didn't work out, but about 60 pounds.
Yeah, no, she was doing good.
Yeah, a while, and now is she back on it? I haven't seen
her lately.
So
no.
she lost at least 60 pounds. By the way,
and she felt better too. It wasn't just the weight. I mean, she felt
great.
it.
When she was doing the pool and everything. So my sister is, she's had some health challenges, and she really had to lose, over 100 pounds, to be honest with you. That 60 pounds, I use the analogy of the 25-pound weight. So she lost, 20 pounds. She was moving quicker, and she was happy.
Yes, yeah.
It's the psychological effect of losing that much weight. It really did help her a lot.
And even at this point, I mean, you have patients who have heart issues and things like that. And I'll tell these patients, listen, I want you to go tell your cardiologist that you're thinking about doing this. I need to know that we're all on board.
Yep.
And every time they are so excited that they're even thinking about it. Like they will always say, absolutely, yes, get on it. You need to be on it. I mean, it's good for cardiac health,
I mean, with my sister Mary, when she first came in, she really had a hard time walking from the couch to her bedroom to take a shower.
Yeah.
Now obviously our goal was 100 pounds, but 60 pounds, it really changed. Honestly,
absolutely.
It changed her life. And without her being on Ozempic, she never would, because it was a lifelong struggle.
Yeah.
Mary's in her late 50s, and it was she was like, she had given up. Like, I'm never going to lose the weight again. And it gave her hope. It gave her hope. Matter of fact, I got to call Mary now. You think I got to call my sister. No, but it gave her hope when and again, what I see when I see people on Ozempic, and I hate to say, are you on Ozempic?
Yeah.
When I was on, they're like, you're losing weight, you're on Ozempic.
Yeah.
Kind of pissed.
And that's still a thing.
Like,
people will always look at. I mean, I have family members that are like, oh my God, she lost so much weight. Ozempic. Like.
Yeah, that's what they say. I know. But then you see someone on Ozempic, and then they work out, and you're like, they look great.
Yeah.
And you don't really know.
And you can't tell.
Does it really matter?
Yeah.
Either way. But with Mary, when someone has lost hope that they can't lose weight, and when they have that extra 100 pounds, this is substantial. That's life-threatening.
Oh, yeah.
It was life-threatening. My sister was
absolutely,
life-threatening. Yeah. It made a huge difference. It was hope. She was like, oh my God, I can do this. The first 20 pounds. She was like a kid. I know you weighed her.
Yeah.
And she wasn't consistent, honestly. We know
it's hard though sometimes. You really need that push. That first couple months, it's all about just pushing yourself until you actually feel the need to fully commit. That's when the results are even better.
Nida, I hate to say it, I kind of avoid the doctor. But,
Yeah.
but
Most people do.
I do a little bit. But Charlie's bedside manner is one of the best. I love Charlie. You know,
Yeah.
he's great. My kid, Maddie goes there. She's
Oh, yeah.
pregnant. So, you were a neonatal nurse.
Yes.
Right? And
Yes,
so
yeah.
until you
Oh, yeah.
came
It's
over.
such a way different direction than what I thought I was going to be
Okay.
doing. But no, I loved it. I did it for 6 years.
That's
I was
fantastic.
I was working with newborns.
So you see
Yeah.
my daughter, Maddie,
Yeah.
who's
She's
9
like ready to
months.
pop.
She's ready to pop.
Oh, yeah.
She's the due date. Well, she's due now. So
Yeah.
any day now, next week,
Yeah.
who knows? But she comes in. You just saw her like a week ago, right?
Yeah.
She's
Just about, yeah.
yeah, it's a couple weeks ago. Yeah, she's ready to go.
Oh, yeah.
She's ready to go. So anyhow, but I just say that because it's getting. I've been to with my kids, and I have been to a lot of offices, and you can feel the vibe. I know we were reading this. I was actually in Idaho. This culture of kindness policy that this clinic had, where I did the NAD IV when I was out west doing some work. Anyway. You read this and you're like, well, why would you need that?
Yeah.
Now, because you have that office.
Right.
It's a culture of kindness policy, guys. And it says workplace culture is the personality and character of an organization and the sum of its traditions, values, attitudes, and behaviors. A culture of kindness has core values of kindness, respect, and compassion, with employees and patients ultimately working towards creating a kind and caring environment to work in. You looked at this, you're like, you know why you looked at it like that? Because that is your environment.
Right.
Now, all offices are crazy. I mean, to be candid, especially, but when I go in your office, I feel it. It's a
Yes.
sense of general peace.
Yeah.
And at my office, we're in advertising and marketing. It can be a little. We have deadlines. We're going to press, and then we have to shoot this podcast, and
Yeah.
and so it is a little intense. Not that yours couldn't
Yeah.
be. Either.
And you can sometimes feel that tension too in
can.
the air. I mean, that saying is so true. You can always sense it.
You can. Well, you're right now. You guys got it going on, in my opinion. Because
I think we're good at just moving all the moving parts. We're just good at figuring it out. And I think it's a personality. I think more than anything, and me and Doc always talk about this. Like we're both Tauruses. Our birthday is literally, I think,
are you?
I think we're both four days apart or something. And it's like just the way we
when's your
are.
birthday?
May 3rd.
I should know that.
Yeah, and he's May 9th.
Okay.
And we're
good, because
Tauruses, so it's like we just go with the flow,
He's May 9th, you're May 3rd?
Yeah.
And that's a Taurus. I'm going to do a
Yeah.
little research on that.
Yeah.
That'll be on our next episode. So when we do your first episode,
Yeah.
we don't know what your show will be called. But anyway, the reason I read this, because you have that culture. And that does come from the top. That comes from Dr.
Oh, yeah.
Simpson and then with you.
That calm
So like you're
energy.
calming me down right now. So they were saying, I don't know if you guys know this. Hey, man. Hey, Chris. Chris is in there. Charlie has a way to, and you do too.
Yeah.
So I know I'm getting nervous. Thanks, guys. She took my man card away, but you do, and that's rare. It's really rare. Is that a Taurus thing?
It has to be, because
Yeah.
we joke about it all the time. He's like, it's just a Taurus trait in us. And it's true. I mean, we're,
Yeah.
we're stubborn. I mean, that's definitely a thing. That's a Taurus thing. But we are both
Is that what you call
huge
it, stubborn?
foodies. Yeah.
I
We're
always call it-
foodies,
yeah.
and we just go with the flow.
That's funny.
That's both of us.
So at this point, I mean, we've covered a lot of ground. Is there anything you'd want to tell our audience, or anything we're missing? We went over the Botox, the different things, the Wellness Collective, which I
Yeah.
love. That really changed your whole
Oh yeah,
practice, in my
yeah.
opinion.
Before, I feel like the chiropractic, especially the name, and when you pull into the parking lot, it says Simpson Chiropractic. It's deceiving. People didn't realize that we were doing so much more
Yep.
than just chiropractic. And we used to all. I mean, sometimes we still even hear it, but the common line from everyone was, "Wow, I didn't know you did that. You guys did that here," or "I didn't know it was so big, and you guys have all this other stuff going on. Like it's amazing. It's a retreat." So Wellness Collective, honestly, was the missing piece. I mean, we
Yeah.
really needed that.
It's awesome.
Yeah.
When I walk out back to you're on the Fraser, they're on Fraser Creek, which has been there. It's a historic creek.
Yeah.
It's so peaceful.
Yeah. And
you
even when you enter, it's very deceiving. When you pull into that parking lot and you're walking in, it's regular waiting room, regular office, but it's when you start going to the back and you start seeing the palm trees and the greenery everywhere. It's so nice.
So we had someone walk in. That's Chris. That is Maddie's husband, right?
Nice to meet you.
No, Nida knows your wife, my daughter.
Yep.
And she asked me when is the baby due? When is the baby due?
Oh,
Right,
she's
but
like
it could be any
right
day
around the
now,
corner.
right?
Could be even sooner, yeah. Yeah,
March
just
12th.
by looking, I'm like, there's no way. She's like another week. I'll put money on that.
So Netta was a prenatal nurse, and
Yeah,
so
neonatal, yeah.
neonatal,
Yeah.
So that's her jam. So it's exciting.
Yeah.
So, what's your prediction?
What's today? February
Yeah,
27th?
we have an on-running bet.
I'm
now.
gonna
I've already lost.
say March 3rd, March 4th.
Ooh. March 3rd.
This is
for
her
Maddie's
second,
baby.
right?
Yeah, Kelly's birthday
Yeah.
is March 4th.
Oof, that's risky.
You were thinking
Oh
March
my,
what?
like March 3rd, March
All
4th.
right.
Like
I'm gonna write this down.
She's low also.
You have to pick
Yeah.
a date, 3rd or the 4th.
Let's do 3rd. Well,
Okay.
just so we put that in universe so that she doesn't have to share a birthday.
She saw her a couple weeks back when she came
Yeah.
in, and she's
I
like,
saw her recently though. I think this past week, like a few days ago.
Okay.
I want to say.
Yep.
Yeah, she's been there.
Yvonne, what's the date you think? We're gonna take a little. This is our.
March 5th.
Okay, Yvonne's.
Everyone, I appreciate everyone.
Hey, this is how it is, Chris. And so we're a family business here. What do you think, Joe? If you had a guess, the due date is March 12th for my daughter's, for Chris's wife's, their new child. The 7th. Okay, so Joe's down for the 7th. I already lost this
Yeah.
bet, so I'm going to take the over/under. I'm going to go. No, I have no idea. So the winner gets a. I'm not even sure, Chris. What's the winner get?
A free session at Mr. Simpson's Chiropractics.
We'll have to talk to Charlie about that. Yeah, we'll talk to Charlie. I'm not going. Sure, why not?
I guess it depends what it is.
Yeah, we'll do something.
Yeah.
Yeah.
funny.
Well, thank you guys. So, is there anything that you're doing new? If you had to tell the audience, what is the next thing? Always, because you guys are
Yeah.
always improving. What would be something you say, hey, we're doing this, or we added this within the
Yeah.
last 3 months, 6 months that we should know about that we didn't cover yet,
Yeah.
or something in the future?
So one of the things that I definitely feel like doesn't get enough attention, and we really recently just started researching more into it, getting really into it, is peptides. Weight loss medications do fall in that peptide category, but there are actual peptides that help with losing weight, building muscle,
Yep.
just overall brain health, overall anti-aging benefits. People are, especially now, more interested in it than ever. I mean, I'll get people randomly come in and say, "Oh, like I have some knee pain, and I don't want to take that traditional route of, my orthopedic surgeon says I need 3 rounds of steroid injections," which,
And a
it's not the
peptide
best.
will do that?
Peptides will help. There are certain peptides, like for example,
How do
there's.
you
Go
How do you
ahead.
take a peptide? Is it a shot?
It's typically it's just like that little insulin syringe.
Okay.
It's an injection, or you could take little capsules,
So it's-
tablets.
Okay.
Yeah.
I'm
The
just
best
curious.
route is an injection, though.
Okay.
So, we get people coming in for, it's a chiropractic office in wellness, so knee pain, shoulder pain, and we'll do, that standard stem cell or PRP to the joint, but
And is that a shot right in the?
right in the joint, yeah, right in that joint. And it's not terrible.
Not too bad.
It's not terrible,
I
yeah.
know Charlie did it for his base. His
Oh, yeah.
it
And
made
he
a
had great
huge
results,
difference.
yeah.
He did.
So we'll do that, but on top of that,
I'm typing in
Yeah.
peptide just as you're talking.
on top of that, peptides in combination with that. So there are peptides that help with inflammation, with muscle injury, muscle tears, things like that to help heal that area. And then you have other peptides that help with weight loss,
Now that's what we talked about.
So those are peptides. They're GLP-1 medications.
Okay.
So that's semaglutide, tirzepatide. But after that, there's one called sermorelin, which helps stimulate your growth hormone and helps boost your metabolism. You can build muscle. You get better sleep at night. I mean, it's really beneficial, and not many side effects, if any.
I think Charlie he does.
Charlie, yeah, he does the peptides, and he loves it.
So I'm still not quite understanding. So peptides. So I would take a weekly shot.
It just depends what you're coming in. So like some people will come in and say, I heard of peptides. What do you recommend I should take? And
So if my knees are
Yeah,
are sore, I would do it
there's
for my
one for
knees,
that,
and
yeah.
I would get a peptide shot in my
yeah,
knees.
so it's like a prescription. So just like the weight loss medication where you're prescribed, this peptide or medication, they send it to your house, and it's depending on the protocol, it's a once a day injection. It could be a once a week injection. So for example, let's say you did come in for knee pain and you want to do PRP, but you want to see what else will help that PRP work. There's
PRP
one,
is
yeah,
peptide.
platelet-rich plasma. Yeah.
Is that's a peptide?
No, so that is when we draw your
PRP.
blood.
Okay.
And we spin it in the centrifuge, so it separates. I mean, what normal vial blood looks like. It's just straight red.
Yep.
We spin it out, and there's this little gel separator in the tube. So after you spin it in the centrifuge for about 8 minutes, the gel divider separates your red blood cells from your plasma. So that yellow plasma is what we're injecting to the site of injury, and you could really inject it anywhere. It has great anti-inflammatory benefits. So to help speed that up, because people want to do everything to help recover, we have a lot of people here that are retired and want to golf, pickleball. I mean, all these things that they're ready to do.
A lot of pickleball people.
Oh yeah, they want to do everything they can to speed up the results. So in that case, I would definitely recommend BPC 157. That's a specific peptide that you inject to the site of injury. It's a small little needle, so as close as you can get, safely. That helps speed that up. So it helps with inflammation, helps with scar tissue.
You just reminded me of something too. So I took the
Tirzepatide.
Tirzepatide. So when we went skiing 2 years ago, remember my knees? I couldn't ski. They were killing me.
Yeah.
I was 240. I lost.
I mean, the weight too.
Well,
will
the weight, really the weight made
Yeah.
it. By losing the weight, I don't have knee issues anymore.
Yeah.
But I would maybe if I'm running hard. So I've been working out with the 5 a.m. club with Chris over here, but I might feel it a bit. You know, it was definitely something. I don't tendonitis. We're not really sure. Chris, what did you think it was? My knee tendonitis.
Definitely had tendonitis.
Yeah. Could BPC is it 157?
157. Yeah.
Could that
Absolutely.
help with tendonitis?
Yes. Yeah.
So, like, I'm supposed to go skiing with my son in spring break, I don't know, next month or something. So, how long before I go skiing would I take the BPC 157?
So if it's already something that you're kind of going through and it worsens when you're doing, a really
I mean, I don't
exhausting
really,
activity.
like right now I don't feel it at all.
Okay.
But I don't want to go out skiing
Like
and
kind
then
of nip
feel
it in the butt. So you could we could just start you out on it a week before, let's say. Because typically once you start it, it's an everyday injection to that site of injury or close enough to that. And you do it for about 4 to 6 weeks. And then you take a break and you see if it's helping at all. It's a pretty short-term, use. So you could do it the week before you're going. Keep doing it while you're on that trip, just to keep that inflammation down. Because you probably have some sort of injury, and you're just constantly waking it up every time you are,
ran track and stuff.
Yeah, I mean, it's just, and it's also just age, wear and tear. I mean, it just is what it is. You could kind of nip it in the butt and keep that pain low.
Okay.
So.
Well, thank you very much. I think we've covered a lot of ground, and you're going to be starting a show, right? That's the plan?
Yep, that's the plan.
It's supposed to have Charlie on it, but I think you're going to be heading the show. So, Nida Rizvi.
Rizvi, yeah.
Nida Rizvi. I highly recommend Simpson Chiropractic and, of course, their new wellness collective. It's really fantastic.
Yeah.
Is there any last things you want to tell the audience?
No, just definitely come by and see us.
Are you open on the weekends?
We are not yet.
Okay.
Well, actually, no, that's a lie. We are. We don't. The providers are not there.
Got it.
But the spa services are open. I want to say it's from 9 to 1. Don't quote me on that. Saturdays. Yeah.
Well, thank you for being on the show. Really appreciate it.
Yeah.
I learned some stuff.
Yeah.
I learned a lot. And you gave some information I wish you wouldn't have. No, it's good. But sincerely, it's been great.
Awesome. Thank
so
you.
much.